I have a lovely lady who came all the way from Wisconsin and came and showed up here without any cheese. So we are still debating whether we should do the surgery or not. The instructions were very clear in the pre-op instructions. If you're coming from Wisconsin, you must bring cheese. If you're coming from Georgia, you must bring peaches. Coming from Idaho, you must bring potatoes, but unfortunately, patients sometimes do not read the pre-op instructions. That's okay, we'll deal with it later, but for right now, just to let you know what the issue is, she's beautiful, gorgeous, and she has a nose that she had done more than 20 years ago, and now she notices changes in the tip area. The tip looks big, there's some big nostril show, and there's wide flared nostrils, so we need to do a revision tip plasty and an Alarplasty. So very excited. We gotta get it all dolled up and ready to go. So let's take a look. So as you can see in the tip, there's a point, and this is cartilage pointing out, and there's asymmetry, and then there's depression right here because there's a bulge on this side. That's what we need to correct. And you can see now the flare. The right nostril is higher than the left, and that is again an asymmetry that is noticeable. Not significant enough for me to notice, but other people will not notice. And as we look from below, as you go down, you can see the diagonal angle on the right and more vertical on the left. So we have to correct those as much as possible, as you can see right there. So we'll do the open approach. You can see an existing septal deviation as well, but it's not significant, does not bother her. There we are. Now as we go on to the side view, you can see the columellar curve and the nostril show. So I plan to do a columellar reduction as well at the same time to reduce that huge columellar show. Between that and the Alarplasty, I think we should be able to have a really nice straight columella, and the nose will not look large, and then you should not be able to look straight into the nostrils. So let's take a look on the other side as well, see what we got. Oh, looking from this angle, you can see, there we go. And here we are right there. Again, the amount of columellar show is huge. So columellar reduction is a must. There we go. I think that makes it very clear. So now we are ready to start and rock and roll. So in this case, there's asymmetry of the nostrils, and I'm trying to correct that, which is very, very tricky. Please don't attempt that if you're just beginning to learn Alarplasty. And let's bring you down over here. You can take a look. So I have marked the area that's higher right there, and the depressed area. So we have to make sure they become at the same level. This is very pointy right here. We need to get rid of that. You can see the markings. I'm taking more on the bottom here along the nasal sill than the left side, because this, if you look from the mid columella to the medial marking, is a lot. From here to here is longer than from here to here. So I have to compensate, bring this one in a little bit more, and then it looks more symmetric. That's the plan. So far, what we did was we started with the Alarplasty and completed it, and we got good symmetry. Then we went on to do the open rhinoplasty, found the cartilages. The lower level cartilages were all crooked and meshed together and pointy, so we had to isolate them. Took about like 5 millimeter piece out around the intermediate crura, and then stitch them together and try to get as much symmetry as possible with the suturing. And after that, now we are closing, and also took some extra tissue off on the left side where I had marked that bumped area to make it equal or symmetric to the right side. And now that this is completed, the last thing is we'll be doing the columellar reduction. Now that we have done the tip shortening, we might not need as much columellar reduction, so I'm glad we saved it for the end. So let's take a look at it now. Okay guys, we are done, and it was not an easy one. If you watch the whole video, if you're a surgeon or a resident, you can see all the intricacies, and you never know what you're going to find in revision, so be prepared. And sometimes you have to harvest the cartilage at the last minute from the ear, or use the rib if needed, but you have to prepare the patient in advance. We were able to just reduce the intermediate crura for overlap and reduce the projection of the tip significantly, pull back the columella, bring in the nostrils, and all that went really well. So let's take a look, and hopefully we'll get some photographs and videos from Wisconsin. right? There we go. Let's take a look. Okay, so there we go. The nostrils have been narrowed adequately and there's excellent symmetry. The bulge that was marked is reduced. The tip looks very good as well. And there we are right there. Excellent. Let's look from different angles as well. Right here, right here, right here. Excellent. Beautiful. Let's look from below as well. And the columella reduction looks excellent. Click the link below to get a free consultation.